Bee pollen is a mixture of flower pollen, nectar, enzymes, honey, wax, and bee secretions. Bee pollen is collected by honeybees from plants and stored in the beehive. It is not to be confused with other bee products like honey, royal jelly, or honeycomb. Bee pollen is recognized as a medicine by the Federal Ministry of Health in Germany. It contains over 250 biologically active substances, including proteins, carbs, lipids, fatty acids, vitamins, minerals, enzymes, and antioxidants. Bee pollen's nutritional content varies based on the plant source and season collected. Bee pollen contains a wide variety of antioxidants, including flavonoids, carotenoids, quercetin, camphorol, and agglutination. Bee pollen may lower heart disease risk factors like high blood lipids and cholesterol. Animal studies have shown that bee pollen extracts can lower blood cholesterol levels, especially bad LDL cholesterol. Bee pollen may also protect lipids from oxidizing, which can raise heart disease risk. Bee pollen is a nutritious food containing vitamins, minerals, carbohydrates, lipids, and protein. It comes from the pollen collected on bees' bodies during flight. Bee pollen is used in various health conditions, including alcoholism, asthma, allergies, health maintenance, premenstrual syndrome, PMS, enlarged prostate, and stomach problems. It is also recommended to enhance athletic performance, reduce side effects of chemotherapy, and improve allergies and asthma. There is no standard dose for bee pollen as it is an unproven treatment. Bee pollen's potential for breast growth. Bee pollen, a dietary supplement known for vitamins and anti-inflammatory elements, is being used to treat hormone issues and potentially increase breast size. TikToker Taylor Reynolds' video, which explains the effect of bee pollen on her breast growth, has garnered 2.5 million views. Ivy Cross claims that bee pollen in her drinks contributed to her breast growth. Despite no large clinical studies supporting the use of bee pollen for breast growth, a diet rich in phytoestrogens, a compound found in bee pollen, can mimic estrogen. A 1990 study found that phytoestrogens in bee pollen may mitigate perimenopausal symptoms and may also be beneficial for PMS, hormonal migraines, acne, excess estrogen, and menopausal symptoms. Other uses of phytoestrogens include preventing osteoporosis, reducing the risk of cardiovascular disease, and treating liver and prostate conditions, high cholesterol, diabetes, obesity, and more. Bee pollen has also been used as a form of allergy treatment. But there is limited scientific evidence to support these claims. Risks of using bee pollen as a supplement include potential allergic reactions, side effects, and lack of FDA approval. Bee pollen's other health benefits: protects liver from toxic substances and disease. Bee pollen may be effective in treating hepatitis and non-alcoholic fatty liver disease. Its antioxidants protect the liver from damage from toxic substances and promote liver healing. Packs anti-inflammatory compounds. Bee pollen extract has been shown to reduce inflammation and swelling, including quercetin, which lowers the production of inflammatory omega-6 fatty acids. It also suppresses biological processes that stimulate the production of inflammatory hormones. Boosts immunity. Bee pollen may reduce the severity and onset of allergies and kill harmful bacteria. Its antimicrobial properties may also prevent infections. Aids wound healing. Bee pollen has anti-inflammatory and antioxidant properties, aiding in wound healing. Its antimicrobial properties may also prevent infections. May have anti-cancer properties. Bee pollen extracts have been found to inhibit tumor growth and stimulate apoptosis in prostate, colon, and leukemic cancers. It may also have anti-estrogen properties, potentially lowering the risk of breast, prostate, and uterine cancers. More human-based research is needed. Bee pollen's health benefits and safety. Bee pollen may alleviate menopausal symptoms like hot flashes and improve cholesterol levels. Studies show that 71% of women with breast cancer reported improved menopausal symptoms while taking bee pollen. Bee pollen supplements also resulted in better sleep, reduced irritability, less joint pain, improved mood and energy, and lower bad LDL cholesterol and raised good HDL cholesterol. Animal studies suggest that bee pollen may enhance the absorption and utilization of nutrients like iron, calcium, and phosphorus, speed up metabolism, and promote longevity. Bee pollen supplements are generally safe to consume, but people with pollen or bee sting allergies, pregnant or lactating women, and those taking blood thinners should avoid them. Bee pollen contains many vitamins, minerals, and antioxidants, linked to health benefits such as decreased inflammation, improved immunity, menopausal symptoms, and wound healing. More human research is needed to confirm these benefits. Bee pollen side effects. Breast tissue growth and cancer risks. Breast tissue growth can lead to cancer due to atypical cellular changes. Mild vaginal spotting or bleeding may occur due to estrogen receptor stimulation in the uterine lining. Digestive side effects like stomach pain, nausea, or diarrhea may occur. Interactions with medications like bee pollen are also risks. Bee pollen supplements should not be taken by those with a bee pollen allergy. Bee pollen's effectiveness in treating medical conditions like menopause or hormone issues is uncertain. Consultation with a doctor is recommended for benefits and risks of natural foods and supplements. Regular breast tissue checks and diagnostic imaging like mammograms or ultrasounds are also advised. Bee pollen is not safe for children or pregnant women, and women should avoid using it if they are breastfeeding. It may cause increased bleeding if taken with certain blood thinners like warfarin.